Our fellowship offers a true upper extremity experience where we basically take care from the shoulders to the fingertips. I think it's a big positive of the program because a lot of hand fellowships really focus on wrist and distal. We're one of the few integrated health networks in the country. We are continually expanding the health system. I probably summarize the culture as basically very Western Pennsylvania, Pittsburgh, blue-collar kind of a program. It's not an observership fellowship. They're actually seeing patients and doing surgery. But in terms of making the right diagnosis, knowing when to operate on someone, seeing an incision that maybe doesn't look so good, is that something you need to go wash out in the OR or is something you can watch? Those kind of decision-making really only happens in the office. So I think it's actually very important that people get a balance OR time and office time. And if there's an interesting case on another service, we'll try to make it possible for them to go see them. In a fellowship program, you have to have a good amount of bread and butter cases like carpal tunnel and cubital tunnel and wrist fractures. But I think part of training is seeing the very interesting cases that you don't see very often or ones that have never been described. If they can apply the same principles to these very rare cases that they see here, then they can apply that for the rest of their lives in their practice. Part of the reason I went into academic medicine is to move my field forward. So I think this is a very exciting health network to be a part of. We're there to teach them to be independent practitioners of hand surgery, so that's the goal. But we try to mentor them, even early in practice. Usually, once they graduate, we often get the phone calls about certain cases or questions about practice. So we're here and willing to mentor them throughout their career.